Today, we're going to walk you through the procedure from start to finish because it is a procedure where the pet owners are not here. So they're probably curious about what happens, why does it cost so much, what is done while my pet's away all day. So that's the whole reason we're doing this, is to show you what is all involved, because there is a lot involved. The first thing that happens is you drop your pet off. You sign some paperwork that says, I give you permission to treat my pet today. And from there, your pet is basically given a preoperative exam. If everything looks good, we give your pet an injection of what we call a pre-med, which is basically medication to make your pet relaxed. It also has some pain control built in so that when we do go in and start using sharp instruments on the gums, the pain medicine's already on board and your pet's going to be much more comfortable, and it's going to make for a much smoother anesthetic. We put an IV catheter in your pet's leg so that we have access to their vein in case we have to give medications during the procedure. Your pet's on IV fluids throughout the entire procedure to support their blood pressure, to keep them hydrated. Then your pet is given an injection to put them under anesthesia, general anesthesia. That injection is only a very short acting injection, probably 5 to 10 minutes at the most. So we put a tracheal tube in the back of the throat, down the windpipe, and then we connect that tube to an anesthesia gas machine, which delivers oxygen and gas to keep them asleep for the duration of the procedure. We can control that level of anesthetic. So if your pet is too deep, we can lighten it. If they're not deep enough, we can increase it. We have a veterinary technician who's trained to monitor your pet through the entire procedure from start to finish. All of these parameters that are standard of care today, we monitor throughout the procedure. We chart it, we write it down in a chart so we have an accurate log of how that pet was doing at every step of the procedure. After your pet's anesthetized, we take dental x-rays, and we use a state-of-the-art dental x-ray machine, very much like a human dentist would do. We put a computerized sensor in your pet's mouth at every location of the teeth. The doctor looks over the x-rays, looks to see if there's anything that needs to be addressed. If it does, if we find a problem, we call you right away. If there's no problems, then basically we proceed straight on into the dental cleaning, which involves a specialized unit machine that has a scaler. It's used ultrasonically to take off that really hard calcified tartar and plaque that builds up. It's what you see that's brown on your dog's tooth. It can also go under the gum line and create pockets of bacteria, and that's what you smell. The doctor then examines all the teeth once they're cleaned. Once that's done, we use another special piece of equipment called a polisher, and it's very similar to what your human dentist would use. We use a pumice type gritty paste, and we put that on the polisher, polish all that enamel up so it's nice and smooth. There's no micro nicks or cuts in that enamel. And then sometimes we also add a sealant to the teeth to protect them from bacterial infection, which can last sometimes several weeks. That's basically the full procedure. After that, we wake your pet up. We turn the gas anesthesia off. Usually they're awake within 5 to 15 minutes. They are monitored through their recovery, made sure that they're comfortable, they're breathing, their temperature is okay, no pain, no vomiting, anything like that. And then once your pet's recovered, usually within a 2-hour period, we get ready to send them home. And then we go over the whole procedure with you, and we've usually taken photographs of what's going on in the mouth so that you can actually see what we saw. We write out detailed descriptions of it and what you can do also in the future to prevent this from happening or coming back. So it's very detailed. It's an hours-long process, and you don't get to see any of it. So that's why I was kind of explaining it all, so you would have an idea of the value of what you're paying for and what your pet, the benefits your pet is going to get from this.